Okay.
Hello, everybody. Today is 23rd February. Welcome to the Each One Teach One session for today. We are honored to have Wale Williams, our classmate. He will be presenting to us today. Wale is an accomplished civil engineer from OAU, and he also works as a structural engineer and project and contracts manager. He has also earned a master's in engineering management from the University of Johannesburg, where he lives, commuting between South Africa and Maseru in Lesotho. Wale is blessed with two children that reside in Scotland, and he's presently engaged in construction and infrastructure development projects as a construction manager in Lesotho. I'll let Wale tell his own story about how this topic came up. And thank you very much, Wale. We're really privileged to have you.
Well, thank you very much, Digi, for that introduction. I am really honored to do this. And my very first interactions with Each One Teach One was the one that Muiwa did. And it was quite, it was very mind-boggling and eye-opening. So when I was asked to do this, it was a wonderful opportunity for me to actually do more research about this and actually look into my own situation. And I really want to share this. Gentlemen, I will crave your indulgence to allow me also communicate this in some Pidgin, some Yoruba, because sometimes when you're trying to put a point across, when you communicate it in vernacular, it makes the point that you're trying to make. This particular topic for me, it's quite how do you say, it's very important, because I just about a year ago, a little over a year ago, went through a very challenging health episode. I will start this by introducing the topic. You permit me to please read what I've written, because I did quite a bit of research and AI helped me a bit. Came from my own experience. So the topic for today is overcoming health challenges. And if you look at the introduction itself, it says, in this intricate dance of life, we're often faced with challenges that test our resolve, our resilience, and adaptability. Among these health challenges can be particularly daunting. Among these, health challenges can be particularly daunting as they strike at the core of our well-being, affecting not only our physical capabilities, but also our mental and emotional states. Now, this introduction basically, at this stage in our lives, a lot of us are sitting in our fifth floor now, and we are quite vulnerable to a lot of these health challenges because of the kind of lifestyle we've lived, our present location where we reside, the kind of environment that we're exposed to, the kind of food that we eat. So at this, we are privy to a lot of these health challenges, some which occurred probably as we're attaining our 50s, or some that just happened suddenly. So, the next paragraph says, the journey to overcome health challenges is a testament to human strength and spirit, showcasing our capacity to adapt, persevere, and triumph in the face of adversity. Now, that introduction in itself basically is saying that a lot of health challenges that a lot of us are starting to face or are facing, they are things that, well, in most cases, it's bound to happen to us. And overcoming it is one of the challenges that we have to face going forward. So that journey to overcome it is basically the test of our strength. So as I was saying, let me put up my audio so that you guys can hear me more. I think, yeah. All right. I'm thinking everybody can hear me now. Next
We
slide,
can hear
Deji,
you, Wale.
please.
Go ahead.
Okay, thank you. So if we look at the various forms of health challenges that we're having, that a lot of us are facing, if we start from chronic illnesses, mental health, sudden injuries, and life-threatening diseases, these various challenges are some of those health challenges that we'll face or that we're facing at this stage in our lives. You know, a lot of us are dealing with chronic illnesses, mental health issues, or even sudden injuries that just happen to us. Maybe we're walking and then we maybe sprain our ankle, or maybe from exercising we pull our hamstring, or or even life-threatening diseases like things that just happen to us that we do not even know. It just happens. If we look at the physical forms of health challenges that we're facing, if you read that right up, it says physically, overcoming health challenges often involves a combination of medical treatments, lifestyle modifications, and rehabilitation efforts. These are some of those physical challenges that we encounter. Now, advances in medical science have provided us with an array of tools and therapies that can significantly improve our health outcomes. However, medical treatments alone are rarely sufficient. You see, a lot of physical things that we get into, we actually can help us to overcome these health challenges, so much so that just popping tablets alone is insufficient. Now, embracing a healthy lifestyle, incorporating balanced nutrition, regular exercises, and adequate rest, these are crucial in supporting the body as the body's healing process and enhancing overall well-being. These physical things that we do, for example, that is something that I battled with because I'm a very picky eater. I really do not like vegetables, or I don't like onions in my food. But I realized that these are some of the physical things that we have to do to overcome some of these health challenges. Regular exercises. I was the last discussion I had when we was presenting, we were talking about me going back to the gym. A lot of the exercise that I get involved in because of the type of work that I do. I'm in road construction most times. For the past 10 years, I've been doing that. It involves me walking a lot of the lengths of some of the roads that I'm busy with. And I get a lot of my exercise from that. And doing that made me a little complacent about doing other things. But I believe then at the time that walking is a very good exercise. It helps you burn calories and does all that. A lot of us, we don't sleep, eh? Well, let me speak for myself. I really hardly sleep. I mean, I go to bed around 1 a.m. and I wake up at 5. My alarm goes up at 5. Sometimes I go to bed at 2 a.m. There's always something to do. So getting proper sleep is one of those things that you can, use that can help you to overcome some of these health challenges. If we go to the next slide, which is mental, it says here that mentally, the impact of health challenges can be profound, often leading to stress, anxiety, and depression. Addressing the mental dimensions of health is essential in fostering resilience and maintaining a positive outlook. Okay, you see, a lot of us, we do not even know that we have stress. We just say it. But stress and anxiety, some of it leading to depression, you know, they impact those health challenges that we're talking about here. Now, techniques such as mindfulness, cognitive behavioral therapy, and a support group can play a pivotal role in managing mental health and building emotional strength. Only recently are people beginning to understand that there are mental health issues that we deal with every day. Some of us, we don't even know that we have those things, you know. Cultivating a strong support network of family, friends, and healthcare professionals can also provide invaluable encouragement and assistance. We'll examine this further down the slides, how a lot of this mental behavior can help us to overcome some of these health challenges that we have. If we go to the next slide, it's the emotionally, the journey to overcome health challenges is marked by a roller coaster of feelings, from fear and frustration to hope and triumph. Acknowledging and processing these emotions is vital. It's a vital part of a healing journey. Now, I can say from experience that the emotional journey itself, it's like it's described there, it's a roller coaster of feelings, because when you encounter a very serious health episode, it becomes you become so engrossed and you become so afraid. Oh my God, am I going to survive this? Am I going to be okay later? The fear becomes frustration. And as you continue to deal with it, you start to have hope. Okay, you know what? I'm not going to die. Okay, thank you, Jesus. I'm not going to die. And then you become victorious. So if it starts to acknowledge these processes of emotions, they help you in that healing journey. It says here, practices such as journaling, meditation, and creative expression can help individuals navigate the emotional landscapes and find meaning in the experiences. Some people dealing with their emotions, some of them just write in their diary, others go to yoga and meditation, some paint, so others do sculpture. Some of the things that we just, you know, um, help you calm you down. Those things that help you, in your emotional journey. Another part of those the importance of the community, the people that you surround yourself with. In the next slide, it says the importance and shared experiences should not be underestimated. And that is true. When you surround yourself with a community of people who will help you to recover, people who will help you to deal with uh, uh, this emotional and this health challenges. That thing is so important. It says they're connecting with others who are facing similar health challenges can provide a sense of belonging and reduce feelings of isolation. And that is so true. When you are undergoing this very serious health challenge, and you have people who have been there, people who have suffered the same, episode as you, sharing their stories and telling you and advising you on how, they dealt with it. It really, really, really helps. It says they're sharing stories, advice, and encouragement can foster a collective strength that empowers individuals to persevere and thrive. We must understand that dealing with these health challenges is a multifaceted endeavor that demands a comprehensive approach, addressing physical, mental, and emotional aspects. You see, it is a journey that requires resilience, adaptability, and an unwavering spirit. By embracing a holistic perspective and drawing strength from both within and from the community, individuals can navigate complexities of health challenges, emerge stronger, and more resilient. When I was writing this, I realized how much surrounding yourself with people who have been through this, how it helps you. It gives you some sort of confidence that, okay, you know what, if he can survive it, so can I. It helps in addressing both your physical, your mental, and emotional state of mind. The fact that you feel victorious, that you have survived this, it's a real morale booster, I promise you. And it helps you, obviously, to deal with those health challenges. Now, if in the next slide, it says the importance of health and well-being. Well, you see, at this stage of our lives, in our fifth floor, I'm sure a lot of us in this group were over 50. If there's anybody still on the 49th floor, the Lord God will give them the grace to achieve and come to the fifth floor like a lot of us. But at this stage in our lives, it is important that we maintain our health and well-being, especially at this age. This is our middle age, our most vulnerable age. You know, physically maintaining good health enables us to perform daily tasks with ease and engage in activities that bring joy and fulfillment. A lot of the activities we are in that we participate in, it's supposed to make us live, enjoy our lives, irrespective of wherever we live, or wherever in this world that we're located, that we reside. Says your regular exercise, a balanced diet, adequate rest. Those are those things I said earlier. When we are physically healthy, we can enjoy life to its fullest, taking on new challenges and adventures without hesitation, and that is true. A lot of us are able to continue to enjoy our lives because we do not have any health challenge, and even if we do, it's quite minor things that we can deal with. A small headache there, maybe a flu there. For people who live in countries where the flu is very prevalent, maybe a cough there, some even maybe toothache or something. But it is important that at this stage in our lives that we know the importance of our health. Mentally, health and well-being are intertwined, and that is true. With our capacity to think clearly, manage stress, and make good sound decisions, mental health disorders such as depression, anxiety, can be as debilitating as physical ailments, affecting our ability to function and enjoy life. Person wey sick, na I know. Person wey never sick, they know at all. When you really, really appreciate your health is when you are sick. I promise you, man, you will beg God to take everything else you have and give you your health back. Take it from somebody who's been there. Prioritizing a mental health through mindfulness therapy and self-care practices can help us to maintain emotional balance and resilience. It is crucial to recognize the signs of mental health struggles and seek help when needed, as mental well-being is just as important as physical. You see, what this paragraph is saying is a lot of us, we do not even know that we have mental issues. Some of us are so stressed, some of us our anxiety is so high towards depression that we don't even know that we have mental health issues. Our physical health in itself is our mental health is as important as our physical health, because a lot of us, we do not put a lot of attention to our mental health. In the next slide, it says, emotionally, our well-being shapes how we perceive and interact with the world around us. And that is true. Positive emotional health allows us to build and maintain healthy relationships, cope with life challenges, experience happiness and contentment. And practicing such activities like meditation, journaling, spending time with loved ones can nurture our emotional health, fostering a sense of connection and purpose. You guys, I don't know if anyone stands, and over here we really do not have a lot of this. But for those who live in Nigeria, I really envy you guys. That social gathering that we have, where we all meet, you do not know what that does to your mental health. That camaraderie, that feeling of being amongst other people is one of the most precious emotional feelings that any human being can have. And is a function of where you live. Over here in South Africa, there's not a lot of things like that, though there are, but it's not, it has various degrees. I mean, gathering with your colleagues at the office or having a party with your friends, like what you guys do sometimes in the UK, where you guys meet and go for a boat ride. Things like that, we envy you guys. You see, it is so important. Those things, they really, that feeling of there's somebody there that I can talk to. It does quite a lot for your mental health, believe me. And for some of us who don't have, we get on a plane and we go to Nigeria or even come to London and have such gatherings. It does so much. It does so much for your mental health. So socially, our health and well-being impact our ability to contribute to our communities and society at large. When we are healthy, we are better equipped to support others, engage in meaningful work, participate in social activities. A healthy population is the backbone of a thriving society, driving economic growth and fostering innovations. A lot of people do not understand the importance of having this WhatsApp group. I honestly didn't believe in it initially because at the time I was just too busy to participate. And that thing, I'm still trying to drive it out of my system, to participate in discussions, to be alive and contribute my own 2 pence to a discussion. It is so important for mental well-being. Honestly, if we now go to the next slide, the common health challenges that we have. All right, this modern world that we live in, wherever it is that we live around the world, health challenges are a common part of our life. They affect us. They affect all types of people and all types of backgrounds and all types of age groups. They can arise from various factors. It can be a genetic disposition, your lifestyle choices, your environmental influences, and social determinants. For example, if we're talking about genetic dispositions, I'm diabetic. And I know that I got that from my dad because my dad is also diabetic. Some of us is the kind of lifestyle that we choose, Some of us are party people, drinking, smoking. Some even go as far as drugs. Others, they have their environmental influences. I mean, places where they live, the environment in which they find themselves, and the social determinants, obviously. Now, understanding the nature of these challenges is crucial for effective prevention, management, and treatment. You see, when you understand your situation, a lot of us, it's probably has taken us a bit of time to understand it because of our immediate circumstances, Probably if I had been a little wiser and had taken better precautions. Though I do know that those things, because I mean, at this stage, I am aware that some inherent health challenges are inherited, but you do not actually understand it until it's smack in your face and you're dealing with it directly. Take chronic disease, like the next slide. You see, one of the most prevalent health challenges that we have is chronic disease. Just as I was saying, um, when you encounter an episode of chronic disease, it's something that you have to live with for the rest of your life. It needs management. For example, it says here, among the most prevalent health challenges are chronic diseases, which require long-term care and can significantly impact an individual's quality of life. Chronic diseases, also known as non-communicable diseases, are long-lasting conditions that usually progresses slowly over time. And a lot of us are dealing with these chronic diseases, some knowingly and some even unknowingly. For example, cardiovascular diseases, heart disease, hypertension, diabetes, type 1 and 2, chronic respiratory diseases, chronic obstructive pulmonary diseases like asthma. Asthma is even quite common. A lot of people have that thing. Cancers, that word that everybody is afraid of, the various types, the breast cancers, the lung cancers, colorectal, cancers, prostate, all those things. Chronic kidney diseases, Alzheimer's diseases, and other dementias, arthritis, and other musculoskeletal disorders. These are chronic diseases that a lot of us are dealing with, either knowingly or unknowingly. These chronic diseases are those very, very challenging diseases that you have to deal with and manage for the rest of your life. It is so, these things are, when I started writing this thing and I started doing the research and reading more about it, I became really, really emotional and probably kicked myself that I didn't take action early enough. It's something that we have to deal with. In the next slide, it says mental health issues. Now, these mental health issues, they are an integral part of our life, just like chronic diseases. Anyway, they often remain misunderstood and stigmatized. The mental health issues I was telling you about. A lot of us are suffering from this thing and we don't even know it. These issues encompasses a wide range of conditions that affect an individual's mood, it affects his thinking, it affects his behavior, and his emotional state. And a lot of this thing, we don't even recognize it. Sometimes a lot of us, when we just sit down and we just start looking or start thinking, we don't even know what is happening. Anyway, they arise from various factors. These factors include genetic predisposition, traumatic experiences, and chronic stress. A lot of us, like some of us who are hypertensive, there are things that we inherited from our parents, from our families down the line, or from a traumatic experience, like if you have been hijacked or you've been robbed or mugged, or you were involved in an accident that you survived. A lot of these traumatic experiences, they affect our mental health. And of course, there's chronic stress. The chronic stress that you don't even know that you're even going through. Imbalances in brain chemistry, obviously. So, addressing mental health is essential for fostering resilience, maintaining a balanced life, and achieving personal and professional goals. So if we now recognize these things and we are able to address them, we start to get some sort of healing from it. So for example, common mental health issues that constitute significant health challenges. Lately you get all these social media posts about people being depressed. It said it's a persistent feeling of sadness and loss of interest and can interfere with daily functioning. It is so true. If you see some of these social media posts that are going around about people climbing high places and want to jump down, or somebody running in front of a car so that the car can hit him, or somebody jumping from Third Mainland Bridge into the Atlantic there. These people are suffering from depression. And it's a very, very terrible mental health issue, believe me, guys. Another one is anxiety disorders. It's a condition that characterized by excessive fear or worry, such as generalized anxiety disorder, panic disorder, social anxiety disorder. A lot of people, they are always scared, always afraid. They're afraid to walk out in their house, probably because of maybe a post-traumatic stress issue. Some of them they get into panic attacks. Some people cannot even speak in front of a crowd. They can't address people. Some others they have social anxiety. They can't be in a gathering. They can't attend parties. You see them. They are curled up in their room. They don't come outside. They stay on their phones sometimes. These anxiety disorders, that's what. And then if you go to the next slide, people who are suffering from bipolar disorder, it said it's a condition marked by extreme mood swings, including episodes of mania and depression. Some people, they say things to other people like, hey, when you are bipolar, well, you have a bipolar behavior. It is true. All of a sudden, they're just moody. All of a sudden, they're depressed. The 1 minute they're happy, the next minute you just see them, they're just quiet in a corner, like observing. It's a very, very terrible mental issue that a lot of people have, but they don't even know how to deal with. Schizophrenia is a severe mental disorder that affects thinking, emotions, and behavior, often leading to distorted perception of reality. People all of a sudden, they will just start behaving abruptly, abnormally, start thinking things that are not there, always afraid, always shaking. It's a terrible, terrible mental health disorder. And of course, PTSD. We are all familiar with PTSD. Somebody who's been attacked, somebody who's been raped, somebody who's had an accident, maybe a car accident, or maybe some sort of accident at work. It's a condition triggered by experiencing or witnessing a traumatic event, leading to flashbacks, severe anxiety, and uncontrollable thoughts about that event. One of the worst of it is a woman who's been raped, or somebody who's been in a car accident, or maybe an accident at work, or somebody was attacked or robbed. Relieving that trauma is one of those mental health issues that a lot of us are dealing with. You have OCD people, obsessive compulsive disorders. It's characterized by unwanted, persistent thoughts, obsessions, and repetitive behavior. A lot of us have this OCD, but we don't even know it. Our things must look exactly like this. This thing must be placed exactly here. Any distortion from that, and we just go berserk and go crazy. It's a terrible, terrible mental health issue. Eating disorders. People just eat and eat and eat. And they always say that people, they eat away their feelings, as they always say. Or those who don't even eat. And you just look at them, they look like a bako, that bako that we used to brush our teeth. These are some of those mental health issues that we're dealing with. Then, of course, in the next slide, ADHD. attention deficit and hyperactive disorders. We see a lot of this in our kids. We see a lot of these things, and sometimes it's scary. Said it's a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity. These things we see them, even agbalagba's, they have these things, that they are so, sometimes they're just gone parfait. You're talking to them and they're just looking into the air and you don't even know that they're still there. No, even they don't even know that. You say, what did you say? What did you say? Or kids running around the house, just scattering everything, screaming and making noise. And you wonder what is wrong with this child. Some characterized by slap at the back of our head. Pow! And I was like, Joko, yeah. Those are our parents. Yes, I kiri má ṣe rẹ̀ léṣe ìwọ ọmọ yìí má parẹ́. I'm very for that. Those mental health issues that we don't even know we've had since we were kids. And then we develop it in our old age and we're still wondering how the hell did we get here? And of course, there's the substance use disorders, smoking, drugs, drinking, all these things. They impair our lives, our daily lives. So it is important to recognize, acknowledge, and subsequently address these mental health issues through the following. Obviously, there are some ways that you can deal with it. Clearly, therapy is one of them, of course. Medication, clearly the most popular, because, so for example, kids with HDD, they'll give them medicine that, lifestyle changes, for people who drink or smoke or use drugs, you just decide that it's time for me to just change. I have a friend who's been smoking for like 35 years. And that he just one day, I think it was on his birthday, one of his birthday, he just stopped smoking. And he hasn't smoked for 6 years. I said, how the hell did you do that? He said, I just decided. I said, God, I pray for you. I pray for the kind of resilience that you have, that you can just change something like that. And of course, there's support systems, surrounding yourself with support systems, which we'll deal with, later in the slides. Undergoing these issues are crucial for improving the quality of life and fostering overall well-being by promoting awareness and reducing stigma. Because stigma is another thing. When you see people who use drugs, you just stigmatize them. But he needs help. That person needs help to change, So by promoting awareness and reducing stigma, we can create a more supportive and inclusive environment for those amongst us facing mental health issues. That particular paragraph packs a lot of punch. A lot of people need help with the issues that they have. Let's look at the next slide where it says the lifestyle-related issues. We deal with mental health issues, lifestyle-related issues, our daily habits, our choices, our behaviors. They can profoundly impact our overall health and well-being. Yeah, honestly, the way we live our lives, they have a huge impact on our overall health and well-being, the way that we live our lives, the way we behave, the way we behave. Lifestyle-related health challenges often stem from patterns that develop over time, influenced by factors such as, just like I was saying, our diet, our physical activity, sleep, stress, substance use. These patterns are patterns that we've developed over time. Our diet, the kind of food, for example, the kind of food that we eat. I mean, when I was living back home, I was eating some type of food. When I moved out here, I was eating another type of food. The physical activity is another thing. What we do our physical activities. For some of us who, I mean, there was a time when I just moved to South Africa. We used to play soccer, football every Sunday. After church, we're going to play ball. After church, we're going to play ball. And that actually, apart from the fact that it was a camaraderie thing, because you meet with the same guys every Sunday. You talk about what happened in the week, and all of you. And after that, we all probably just have dinner, or we just meet somewhere and sit down and talk. You know, some go and play basketball with their friends. Probably after work. These are things, those are patterns that we developed over time. Those things they influence our health and well-being. Sleep. A lot of people, once it's 8 o'clock, they've gone to bed. Stress is another thing. The type of stress that we deal with every day, physical, emotional, from our families, from our friends, our colleagues, and of course the substance use, smoking, drinking. These are habits that we've developed over time. It's become part of our lives, our behaviors, and they influence our health and well-being. Now, when we address these challenges, the type of approach, it requires us to adopt an approach that will help us become healthier. Some of us might even think it's too late, that, hey, I've been smoking for 20 years and I know it's bad for me, but how can I change? Hey, I can't do without my whiskey on a Saturday night. You know? Or you look at that KFC. And these are the things that we've been doing over a period of time. So addressing these challenges, it requires a proactive approach to adopting healthy habits and make mindful choices. At this time in our lives, especially when we are in our 50s, such things are difficult, but there are things that we have to do. For example, if you look at the common life-related health issues in the next slide, obesity. A lot of people are suffering from this and they don't even know it. They say, no, I'm comfortable in my skin, but you weigh 140 kilograms. So some of these lifestyle-related health issues, for example, obesity, excess body weight resulting from poor dietary habits and lack of physical activity, leading to increased risk of various chronic diseases. A lot of us, even at this stage, we are obese. And sometimes you don't chastise yourself for it. It comes from the habit that you have built over time. We eat whatever we like, we eat junk, we eat processed food, and we eat crap. A lot of us. And some of us, sometimes, for example, in my case, I live in an environment. A lot of my work is usually remote. And you are not exposed to very healthy food choices. So you eat what's available there. And you realize that you're eating junk, but that's what's available. And then you gain weight around the waist, and it's a problem, my brothers. It's a problem, my brothers and sisters. Sedentary lifestyle, prolonged period of inactivity, often associated with modern work environments, and screen time, contributing to poor cardiovascular health and musculoskeletal problems. Some of us, our work requires that we sit for a long time in front of a laptop, in front of a computer, or we sit in an office, and usually does not permit us, um, to have activities like maybe walk around or go up and down the office. Some of us are rooted in our seats. And these are things that has happened to us, for a long period of time. It's become part of our daily activity, poor nutrition, diet high in processed foods, sugars, and healthy fats, lacking essential nutrients, can lead to deficiencies, weakened immune functions, and chronic conditions such as diabetes and heart disease. And that is so true. Just like I was saying, the poor nutrition, the terrible rubbish that we eat or we expose ourselves to is one of those issues. Smoking, excessive alcohol consumption, sleep deprivation, chronic stress. Chronic stress is prolonged exposure to stress that can lead to mental health issues like anxiety and depression, as well as physical health problems such as hypertension and weakened immune responses. Those are some of those challenges that we face. So in the next slide, it says recognizing and understanding the impact of these lifestyle-related issues on our health and taking proactive steps to modify behaviors and adopt healthier habits will ultimately improve our health and quality of our lives. And that is true. These lifestyle-related health issues, they are things that, like our forefathers, the things that we caused ourselves. And probably at this our age, maybe it's not too late for us to change some of those things. I heard somebody say something today on TV when I was watching. It says we should take care of our health from age 1 to age 50. And then we should take care of our body, from age 1 to age 49. And our body will take care of us from age 49 beyond till when we go to our creator. And it kind of made sense to me. But, it is a very, very profound thing that at this stage, it's time for our bodies to be taking care of us, but we're still taking care of our bodies because of the way that we have lived our earlier lives. So some essential strategies to adopt in overcoming these common health challenges. They include, obviously, we said that eating a balanced diet. Well, not a lot of people can eat a balanced diet every time, but at least we try to eat a balanced diet as often as we can. Engaging in regular physical activities, getting adequate sleep, recognizing your stress triggers and managing those stress. Another thing is recognizing our stress triggers. A lot of us, we don't recognize our stress triggers, things that give us stress. Some people, it might be screaming kids. Some people, it might be, noisy neighbors. Some people, it might be overwork. Some people, it might be the environment in which you work. For me, sometimes my stress triggers is people who are not doing what they are supposed to do, but they know what they are supposed to do. It just pushes me off the edge, because a lot of time we demand that the quality of whatever it is that you are expected to produce should be at the highest and the best of your ability. So stress triggers, a lot of us, we need to start recognizing those things that triggers our stress. It helps us in dealing with our lifestyle-related health issues. Of course, avoiding harmful substances such as alcohol, smoking, and harmful drugs. That one is a no-brainer. At this stage in our lives, especially when we're on our fifth floor, it is time for us to start getting rid of those things that we know and we are sure that affects our health. In the next slide, it says factors contributing to health challenges. Just like we've been saying, health challenges can arise from a myriad of factors, each contributing uniquely to the overall burden of disease and well-being. Understanding these factors is crucial for effective prevention, intervention, and management of these issues. So we need to start understanding some of those factors that contribute to our health challenges. Genetic predisposition. Some of us, like I said earlier, we inherit these things from our parents, from our grandparents, some of these risk factors. And we know, eventually we know. For example, like I said, my father's that was diabetic. So it was only a matter of time before I start to feel the symptoms or to realize that, you know what, but maybe you're diabetic as well. You need to watch your risk factors for being diabetic. My dad was also hypertensive. So I knew all those things. But you know, when you call now, you will not even think about it until your body starts to tell you. Environmental factors. Depending on where in the world, where you live in the world or on this earth, you know, you're dealing with things like pollution, exposure to toxins, climate change, living conditions, you know. A lot of people are exposed to a lot of these factors that affect our health. For example, some people who live maybe in downtown Beijing in China or somewhere in India, or even some of us who live in South Africa here, our living conditions, the kind of climate we're exposed to, those things, they affect our health. Behavioral factors, you know, unhealthy diet, physical inactivity, smoking and excessive alcohol consumption, social determinants, like your socioeconomic background, you know, your education, the access to healthcare, social support networks. All these things, they are factors that contribute to our health challenges. You know, chronic stress is a result of long-term exposure to stressors or stress stimuli, which affect your mental and physical health. You are constantly living with people and neighbors who constantly stress you with their behavior. You work with people who constantly put you in stressful situations. Those things, they affect your mental health. Infections, shit, bacteria, viruses, parasites, COVID-19. Those things, they affect, of course, occupational health. For some of us who are in workplaces where we're exposed to harmful substances, strenuous activities, or a difficult and hazardous environment. For example, people like us in construction, we are constantly exposed to very, very stressful workplace situations. Some of us who are in, for example, in building, and you're on the 17th floor of a high-rise building, you are so exposed to those hazards. And finally, aging. You know, our natural aging process, you know, they expose us to these various health challenges. As we grow old, we become more vulnerable. Our body is no longer as strong as it used to be. You know, we're not as strong as we used to be, but we're still doing similar or same or even way more dangerous work, you know. So these are some of the factors that are contributing to our health and well-being. So addressing these contributing factors through targeted interventions and public health strategies, we can work towards mitigating health challenges and improving overall well-being. And you know, these days it's not difficult uh, to start understanding this situation, because at this age, at least we can clearly say or categorically say that we know ourselves, we know our bodies. So a lot of these things that we're surrounded ourselves with, once we start to understand it and address it, it will help us mitigate some of these health challenges. In the next slide, it says strategies for overcoming health challenges. There are strategies, you know. It says here it's a multifaceted endeavor that requires a comprehensive approach, addressing not only the physical aspect, but also the mental and emotional dimensions. We've talked about this earlier. Implementing the following effective strategies can significantly improve health outcomes and enhance overall well-being. Now, we were talking about this earlier, but we're going to break it down now. Now, these strategies, they include adopting a healthy lifestyle, preventive healthcare, mental health support, social support and community engagement, personalized healthcare plans, and healthy coping mechanisms. We can actually subdivide this into the following. For example, adopting a healthy lifestyle. We talked about this earlier. We talked about balanced nutrition. Eating well is a very, very good thing. For example, consuming a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. These are essential for maintaining optimal health. Avoiding processed foods, excessive sugar, unhealthy fats can prevent chronic disease such as obesity, diabetes, and heart disease. And that is so true. A lot of us, we've heard this from our doctors. We've heard this from a lot of our health professionals. And they tell us to eat well, eat fruits, especially at this age, at this stage in our lives. They will tell us to eat more fruits and vegetables, eat more whole grain cereal, avoid sugar. They even tell you don't eat sugar. Don't eat burger, don't eat donuts, don't drink excessive alcohol. We hear this from a lot of our doctors. Every time we hear this. And of course, regular exercise, engaging in regular physical activities such as walking, jogging, swimming, or yoga helps to strengthen the body, improve cardiovascular health, and boost mental well-being. Exercise also plays a crucial role in weight management and reduces the risk of chronic conditions, and that is true. I didn't, if you, I don't know, for those who listened to me the other day, he was telling us the importance of having a physical lifestyle, exercise routine, something that works for you. A lot of us at this age are not advocating that we do rigorous things, but things that help us to get moving, things that help us to have to improve our strengthen our cardiovascular health, Then if we go to the next one is adequate rest. A lot of us, we know the importance of sleeping well. They always say that when you're a baby, you sleep longer, but as you grow older to your peak age, you sleep less. But from your peak age coming down to your old age, you sleep more. Before, my usual sleep period is between 3 and 4 hours. And that really affected me quite a bit. Because I realized that if I wasn't sleeping well, and when I wake up, I'm groggy and stressed, but I have to go face my 9 to 5, It says here, adequate rest, ensuring sufficient sleep and rest is vital for the body, for the body's repair and rejuvenation process, and that is true. Aiming for 7 to 9 hours of quality sleep per night can improve cognitive function, mood, and immune response, and that is so true. Getting adequate sleep, especially at this age where we are right now, it is very, very important that we get sleep, that we find time to sleep. Sometimes I just lock myself in my office and put my head on my table and get that small 1 hour snooze. And it does quite a bit because I've not really slept very well at night. So getting adequate sleep, it's very, very important. Then, from adopting a healthier lifestyle, we go to preventive healthcare. Depending on where we live in the world, some of us have family doctors with whom we've entrusted our family's health. Like, hey, go to Dr. Shware if you're feeling so. Oh, the kids are sneezing or they have a flu. Hey, take them to Dr. Shware. We have family doctors from where we can get our routine medical checkups. I usually, until I became really, really very busy, I usually have a medical every year, right after my birthday. Right after my birthday, that week, probably after Easter or so, I know that I have to go see, I have to do routine medical checkup. But even at that didn't really even help me, because those checkups, I was told some things. I said, no, don't worry. Hey, man, come. Your sugar level is so high. You need to be, okay, I'll stop drinking fizzy drinks, because I really didn't drink alcohol at all. And I never smoked. But those things were there. My stubbornness, it didn't let me take action at the time, probably because I was too busy trying to build a career, basically. I'm just talking for my own, and I know a lot of us have our stories. So regular checkups is very important. Routine medical checkups and screening can help detect potential health issues early. That operative word there is early, allowing for timely intervention and treatment. Preventive measures such as vaccinations and regular health assessment are crucial in maintaining overall health. A lot of us will probably not be suffering from this medical issue if we had dealt with it early enough. So routine medical checkup, it's so important. If you're not doing it, you need to start it now. Another one is health education. Staying informed about health risks and preventive measures empowers individuals to make informed decisions about their health. Health education programs and resources can provide valuable information on maintaining a healthy lifestyle and preventing disease. Knowing is wisdom. Having an idea, doing the research. When you start to feel something and then you go to Google Health and then you type, hey, I'm feeling like this, and then it brings you all the information that you need. It's actually a very powerful tool to be able to deal with your issues if you know what is happening to you. For example, some people say, hey, I wake up in the morning and my stomach is always in a knot. What could be causing this? Knowing it's important. It's important. Another aspect is, mental health support. Mental health support is important. A lot of us, we really overlook these things. The importance of the support of mental health. Mindfulness and stress management. Practicing mindfulness techniques such as meditation, deep breathing, and yoga can help manage stress and improve mental clarity. Stress management is essential in preventing mental health issues such as anxiety and depression. There's one technique that I developed to manage my stress. It's a kind of breathing. When I start to feel that I'm in a stressful situation, I just pause for a few seconds and just breathe. That thing has helped me. I don't know if it works for other people, but believe me, that thing helps me. I don't know how to do meditation or yoga and all those things, but sometimes I just sit at my desk and put my foot on the table, fold my arms. And believe me, that thing just works. I just breathe. And then when I feel that that thing has died down a little bit, I just go back to whatever I'm doing. But until lately, I did not even know that thing worked for me. It was just an involuntary thing that I do, like, and then just for a few seconds. And then my heart rate returns back to normal, and I just continue what I'm doing. That thing worked. It works for me. I still do it. It works for me. It's a way that I used to deal with a stressful situation, you know. Another one is, of course, therapy and counseling. Seeking professional help through therapy and counseling can provide support and guidance in managing mental health challenges. Cognitive behavioral therapy and other therapeutic approaches can help individuals develop coping strategies and improve emotional well-being. A lot of us have our psychiatrists that we talk to, psychologists that we have sessions with. And though some people say, that thing doesn't work, right? He's going to tell me what I already know. It's a lie. That thing works. Sometimes when you have somebody you can vent to, somebody you can talk to, some of us don't even have therapists or psychologists. We vent to our pastors. So, Pastor, for 1 minute. Sometimes they're not really completely trained, but they will tell you something that you are not even thinking. Maybe from a third ear, when you share those things with them. Therapists and psychologists, they are trained to help us deal with some of these mental, health issues that we have. Just by sharing sometimes, it unburdens you, when you tell somebody something that's bugging you and the person offers a different perspective, something that you've not even thought about, you'll be amazed at how that thing will unburden you. It's worked for me many times. During my divorce, I did not even understand what was happening. I was too busy being a career person, an engineer, and I couldn't understand what was happening to me. I just don't. I didn't get what's going on, because as far as I was concerned, I was a good person. I didn't deserve this. But then when you hear somebody else tell you about things that you've not thought about, people who've been there, what has happened, you start to understand the reason why that thing happens, and it helps you to unburden. It helps you to look at it from a different perspective and understand the situation, and then eventually deal with it. It really, really helps. We should not run away from counseling. When you share your issues with somebody who is trained to help you look at another perspective of it, it's a very, very liberating feeling to have. Social support and community engagement, that's another strategy. Building a support network. When you surround yourself with supportive family, friends, and community members that can provide emotional strength and encouragement to you, you're a very lucky person. If you live in an environment where you have these support structures, it is a very, very wonderful situation to be in, when you have people, friends who can provide you the kind of support that you need to deal with your mental health issues. It's a very, very liberating thing. Social connections play a significant role in mental and emotional health, reducing feelings of isolation and loneliness. And that's another thing, loneliness. A lot of people, they said, I like to be by myself. I like to, nobody else is listening to you except you. But when you surround yourself with friends, for example, this group that we have, I know a lot of us, we might not discuss personal emotional things, but there are some of us amongst us that we talk to that understands us. It's important that we surround ourselves with this support network. People who think like you, people who have like thoughts, or people who have a different, a different aspect, or a different line of thought. It's important that we have the support groups. You said participating in support groups also. When you're engaged in a support group with individuals facing similar health challenges, this can foster a sense of belonging and provide valuable insights and advice. Sharing experiences and challenges with others can offer comfort and motivation, and that is true. If you're going through something and you have somebody who's going through a similar thing, or somebody who's been through such a similar thing, the kind of advice they'll give you will actually help you. Just like I was saying earlier, when you have somebody who has been through such, or who is going through such, and you people compare situations, sometimes you find strength in the kind of support that you get from that person. It's so important that we find a way to find this kind of group and participate in that grouping. Of course, it's a function of, probably where we reside, where we live. A lot of us, we do not have such in our environment, but some of us who are lucky enough to have community centers where they have all these groups, for example, Alcoholic Anonymous for alcoholics, or people with PTSDs, participating in a support group is so important to help us to overcome some of these health challenges. Another one is personalized healthcare plans. Depending on where in the world that you live, it's important that this personalized healthcare plans is available to help you overcome these health challenges. For example, individualized treatment plans, collaborating with healthcare professionals to develop personalized treatment plans tailored to individual needs and conditions can enhance the effectiveness of interventions. Personalized plans take into account medical history, lifestyle preferences, ensuring a holistic approach to health management. For example, people who have had cardiovascular episodes like me, I have a cardiologist, my doctor, Dr. Marks. This guy, I see him every month. Part of my session with him is just not about the treatment. It also involves, some discussions that we have. He asks me about, my emotional situations and how it's affecting my breathing and all those things. To have individual treatment plans, your health challenge, it's a very, very significant aspect of overcoming it, participating in support groups, monitoring and adjusting actually is important, because as you start to deal with this healthcare situation, continuous monitoring, health plans as needed is crucial for achieving optimal outcomes. Regular communications with healthcare providers and adapting to changing your health challenge. And that is basically what I was saying, that as you start to grow and you start to develop and you start to heal and deal, constantly monitor your growth, the development of the healing itself, so that, like I said, I always meet with my doctor every month. Usually what he does is, now he tells me, okay, now we're going to take you off these meds and then we'll put you on this one, because now when I did the sonar, when I did the CT scan, I happened to you, and so now we're in this next stage. So it's important for you to constantly monitor and adjust your healthcare, your health issues, in order to being that situation to a better one and a better one and a better one. Clearly, when you're dealing with chronic situation, it's something that you manage for your lifetime, but at least monitoring and the information you need to proceed to the next stage of the healing. And of course, the last one being the health coping mechanism. Expressions, it's important that you find things that will help you cope with those challenges that we're dealing with. For example, journaling and creative expressions, engaging in creative activities such as writing can serve as health outlets for processing emotions and reducing stress. And that is so true. That is so true. Usually what I just do is I just put my headphones on and I like to listen to Afrobeat. Sometimes I just, when I'm all by myself and I'm actually doing nothing, I just do some Burna Boy or some lovely piano, and it relaxes me. Some people like to write in their journals, they like to write things down. Some people, they like to do carpentry, they like to, do things that relaxes you. It helps you to cope with your health challenges. Physical relaxations, massages, some people like aromatherapy, things that will take away that tension, that physical tension, something you just, like some people say, I just want to get away. I want to go and where I will not be disturbed, where I will not see anything familiar. Over here in Lesotho, we have a lot of places. We are surrounded by mountains and greenery, and sometimes you just drive up to maybe one of these places. It's so lovely up here sometimes. It's amazing. Just to be by yourself, you can feel relaxed. It helps you to deal with some of your health challenges. So, in the next slide, we say many other strategies, too numerous to mention, but implementing the 6 that I've just highlighted above can take proactive steps towards overcoming this health, thereby improving our quality of life. And that is so true. The journey to a better health is an ongoing exercise and requires our dedication, resilience, and a comprehensive approach that are and emotional aspects of our well-being. Through a combination of health lifestyle choices, preventive healthcare, mental health support, social engagement, healthy coping mechanisms, we can navigate the complexities of health challenges and emerge stronger, healthier, and more resilient. And that is so true. That is so true. Dedicate some of our time to connect with our inner self and our Creator in form of prayer and worship, and be thankful to the Almighty, favor we enjoy daily, irrespective of our present predicament and situations, and irrespective of our faith and religion. This particular, because a lot of people who have, who have suffered a health episode, that this world is actually nothing. It's all vanity. Because when you don't have your health, no matter how rich, how successful, how accomplished you are, you will realize the importance of your health, and you will thank the Almighty God for showing you that path that makes you appreciate that your health is one of the most important, if not the most important aspect of your life. And for that, you will be thankful to you to be able to realize that situation. Take it from somebody who's been there. Believe me. I told God, please just take everything. Just give me back my. Please, God. It really does that to you. So now we go to the importance of preventive care in overcoming this our health. It is important that, they always say prevention is better than cure. It is so true. Unfortunately, it's too late to prevent. So now you have to only deal with the cure. And it's important for us to understand the importance of preventive care, challenges that we face. Preventive care plays a pivotal role in overcoming health challenges by focusing on the early detection and prevention of the and become severe. For some of us who are still fortunate, you are still at a stage where you can prevent those things from happening, because it is a proactive approach to healthcare that emphasizes the importance of maintaining good health through one, regular checkups. We've said that. So part of regular checkups, because when you go to your doctor, you say, doctor, please check my this, check my that, check my this. Or vaccinations, healthcare lifestyle choices. Those are addressing the potential health issues at their onset, their infancy. Preventive care helps to reduce the incidence of chronic disease, lower healthcare costs, and true. Because if you can prevent something from happening to you, it's actually cheaper for you than to start treating it. Okay, one of the primary benefits of preventive care is the early detection of disease, which are screenings and checkups enable healthcare providers to identify at an early stage these risk factors and diagnosis, such as cancer, and cardiovascular disease. Cancer especially, they always tell women to go for mammograms. They always tell me, go for your prostate check, do your this thing. Diabetes, same thing. When they do that, your blood sugar is 18. 18K. Stop drinking fizzy drinks. Stop drinking Coke. Stop drinking, yes, sir. Managing our stress, cardiovascular disease, all those things. Early detections allows for timely intervention and treatment, increasing the likelihood of successful outcomes and reduce the need for more invasive and costly procedures. Routine mammograms and pap smears can detect breast and cervical cancers early. Periodic prostate exam can detect onset of prostate cancer in men, while blood pressure and cholesterol checks can help prevent heart diseases and stroke. These are some of those things that we need to check. And if they detect them early, you can actually deal with them immediately. Start taking preventive things to prevent them from becoming more severe and becoming more chronic. In the next slide, it says preventive care also plays a crucial role in managing chronic conditions and preventing their progression, which is what I was just saying earlier. For individuals with existing health issues, regular monitoring and follow-up appointments help. They help you to manage the symptoms. They help you to adjust the treatment plans. And they also help you to prevent complications, So if you have existing health issues, once you are able to detect them early, they start to, you start to manage it. Preventive measures such as vaccinations to protect against infectious diseases such as COVID-19 and contribute to herd immunity, safeguarding vulnerable populations. We know that already. I don't know how many of us have taken the COVID-19 vaccination, but we took on this side. And a lot of us, we just stock up with those needles, but we know that irrespective of whatever we believe, if we have herd immunity, then we're fine. It's just part of preventing you from being exposed to COVID-19. Furthermore, lifestyle counseling and health education provided during preventive care visits empower individuals to make informed decisions about their health, adopt healthy habits, and reduce risk factors associated with chronic disease. And that is true. If you have the information, you've given yourself the first layer of protection because you already know what's up. You already know what the information is. Moreover, preventive care contributes to overall healthcare cost savings. That is true. If you're able to prevent yourself from having a cardiovascular episode, I don't have to open you up and you pay thousands of dollars for it, then you know you're lucky. By addressing health issues early and preventing the development of severe conditions, preventive care reduces the need for one, expensive treatment, which is so true, hospitalizations, emergency interventions. Yes, once you're able to detect those health challenges early, it saves you a lot of, costs for expensive treatment, being hospitalized in hospitals, which is not an easy thing, I tell you. Or emergency interventions like they have to cut you open and fix your heart. It also promotes a more efficient allocation of healthcare resources, focusing on maintaining and improving health rather than solely treating illness. And depending on what part of the world you live in, governments and healthcare systems worldwide recognize the value of preventive care and increasingly prioritize it in the public in their public health initiatives and policies. And that is true. So in the next slide, we have the support systems and resources available in overcoming these healthcare challenges. Health challenges often requires more than individual effort, and that is true. It necessitates a robust support system that can provide encouragement, resources, and personal and professional care, depending on what part of the world you reside, and that is true. A lot of us where we live, there are various aspects of these support systems that are available. Support systems, this systems encompasses a wide range of resources and networks designed to address various aspects of our health challenges. Some of these key support systems available, depending on your socioeconomic conditions, include, just like we were saying earlier, family and friends. Family and friends, they are the closest to you. They are your primary source of emotional support. That we know. Our parents, our siblings, our friends, they are the ones that are closest to us. They're our primary emotional support system. They provide a sense of belonging and security. That is true. They offer encouragement. They help with daily tasks. They act as your sounding board for concerns and decisions. And that is so true. When you have a very strong family network, it will significantly reduce your feelings of isolation and improve your mental well-being. When you are dealing with a health challenge, a medical episode, you want your family and friends to be close to you. They are the ones that come to you and give you all the support. They are the ones that come to the hospital and bring food. They are the ones that will come and pray for you. They are the ones that will come and say words of encouragement to you and pray with you. They're one of the most important support systems, your family and your friends. Of course, you have the healthcare professionals, your medical practitioners, your doctors, your nurses, the therapists. They diagnose, treat, and manage your health conditions. And regular consultations with them ensure that you receive appropriate medical care, the medications and therapies that you need. Part of their job also includes educating patients on preventive measures and healthy lifestyle choices. That is so true. Support groups, we've talked about them earlier. They bring together individuals facing similar health challenges, creating a community of shared experience and mutual support. That is also important. These groups can come together to deal with various conditions such as cancer, diabetes, mental health disorders, and chronic pain. They provide a safe space for participants to share their stories, exchange advice, and offer emotional support, like Alcoholics Anonymous I mentioned earlier. Counseling and therapy services. These are your mental health professionals, such as psychologists, psychiatrists, and counselors. They provide crucial support in managing emotional and psychological health challenges. Therapy sessions can help individuals develop coping strategies, address trauma, and improve mental well-being. Specialized therapies such as cognitive behavioral therapy, CBT, and mindfulness-based therapy are tailored to address specific issues. We talked about this earlier. Sometimes when you talk to those people, you won't believe when they give you their own perspective of those things, and it's so surreal when you hear other people offer you advice about what you're going through, things that you think it's impossible to deal with. Another is the community health programs. Depending on what part of the world you live, there are local health organizations and community centers located in residential neighborhoods and around city centers. These community centers, they offer you support systems that helps you deal with your health challenges. In some countries, they have shelters where people can go and stay, when they're dealing with one issue, one mental health issue or the other, you know. In those shelters, they have therapists and psychologists that can also help you deal with those issues. They have community centers where they have these gatherings for alcoholics or drug abusers who are going through therapies. They have all these drug rehabilitation centers, that can help you. These facilities often offer programs and resources to support individuals facing health challenges. And these programs may include health screenings, fitness classes, cooking classes, nutrition workshops, and educational seminars. Community health initiatives aim to promote wellness and provide accessible healthcare resources. Some of these, community centers in our neighborhoods, they offer these things and people go there just to belong, or some of these bingo parlors that these old people go to. These things are fantastic support systems for mental health challenges, believe me. Of course, online resources and telehealth. In this 21st century, and you guys, you're familiar with this, digital age, in this digital age, this 21st century digital age, there's expanded access to health support through online platforms and telehealth services. These days, virtual consultations with healthcare providers, online support group, and health information websites offer convenient and timely support. Telehealth services allow individuals to receive medical care and advice from the comfort of their homes. In fact, there was a time I remember way earlier before I had that health episode. I'll just go onto this health platform and type in some symptoms, and then it will give me all this information about things that, well, it thinks is wrong with me. And sometimes you just don't give those things a thought until later when you start to understand it. Then there's employee assistance program for some of us who work in industry where our employers offer us some of these support services. It says here many workplaces offer EAPs, which is employment assistance programs, to support employees facing health challenges. These programs provide confidential counseling, mental health support, and resources for managing work-life balance. EAPs help employees navigate personal and professional challenges, reducing stress and improving overall well-being. So this research actually took me and said, okay, you know what, let me just see some of these people who have had these health challenges, notable people, and I came up with quite a list, some notable people who have overcome health challenges, and some of these people we know. It says overcoming health challenges is a testament to the resilience and determination of individuals, especially those in the public eye. Many globally recognized figures in sports, entertainment, and other spheres of life have faced significant health obstacles, but have managed to triumph over them, inspiring millions with their stories of perseverance. These individuals not only showcase their incredible strength, but also raised awareness about various health conditions, encouraging others to seek help and stay positive. Some of these people who are so rich, and you wonder, hey, this person went through this. Oh my God, and he survived it. It encourages you, like, okay, if he can do it, I can do it as well. For example, they say here, Lance Armstrong. Everybody knows who Lance Armstrong is. He battled testicular cancer in 1996. It spread to his lung, but the guy overcame it. He's still alive. Of course, you all know my sister, Serena Williams, who faced the life-threatening complications after giving birth to her daughter in 2017. Everybody knows about Simone Biles, the Olympic gymnast, suffers from anxiety, panic attacks, and the twisters, as they call it, or the twisties, as she calls it, right from 2016 Rio Olympics all the way to the 2022 Tokyo Olympics. And everybody knows that she was talking about that thing. The same thing. Selena Gomez, that fine girl, had serious battle with lupus. This autoimmune disease that affected her kidneys. Lady Gaga, the controversial Gaga lady, had a struggle with fibromyalgia, as they call it, fibromyalgia, chronic pain conditions that affect millions of people worldwide. Of course, we know about our Wakanda, that man, Chadwick Boseman, the Black Panther himself. That guy had cancer, Wakanda forever. Baba Elton John, the legendary British musician. He's been open about his struggles for alcoholism and drug addiction. We all know that. It was all over the news. Victoria Beckham, postpartum depression. She suffered from postpartum depression after the birth of her son, Brooklyn. Prince Harry struggled with mental health, after the death of his mom. For those of us who know Tiwa Savage, she suffered from chronic depression. Mercy Aigbe, the Nollywood lady, same thing, depression. Dakore Ebuson Akande, chronic postnatal depression. Conor Ferguson, she's a South African actress and producer. She also suffered chronic. So you have all these very famous people who have encountered, very, very serious health challenges, but who have overcome it. And so many other people that a lot of us know are suffering from this thing, but they've been able to, rise above it and overcome it. Such kind of stories, they give you, they give you hope that if those people, irrespective of their situation, can overcome it, so can you. I mean, these are people who don't even have to worry about money, or they are very famous. You would think money is not their problem, but they are going through so much. Some of them are even going through very physical health challenges, like cancer and all those things. And when you hear about it, look at William's wife, Kate, or even look at King Charles himself. These guys are going through serious health challenges. The Pope Francis, as we speak, is in a coma, from what we read from the news, dealing with a very serious health challenge. I mean, this is the head of the Catholic Church in the whole world. I'm pretty sure more than a quarter of the population of the world, this man is their leader, but he's dealing with a very serious health challenge as we speak. And this is not his first time he's been in hospital, but he will overcome it. So such things, they give you hope that if these people who are this popular, who are this rich, who are this known, are going through this health challenge, so can I, and I will overcome it. And they're overcoming it. You will say, no, I will overcome it. So these celebrities, they have not only overcome their health challenge, but have also used their platforms to raise awareness, advocate for better healthcare, and inspire others facing similar struggles. Their stories highlight the importance of resilience, support systems, and the power of sharing one's journey to help others. And believe me, guys, the therapy that you get from sharing your situation, it's so overwhelmingly fantastic. Anyway, By sharing their experiences, these individuals have only inspired others, but not only inspired others, but also contributed to a greater understanding of various health conditions. Their journeys remind us that with determination and support, it is important, it is possible to overcome even the most daunting obstacle. Now, I want to share my story. I mean, I'm not going to take long so that you guys understand the reason why I'm doing this. It is important that, and I thank you guys for giving me this platform to share this. You know, it's helping me deal with both my physical and my mental health challenge, my mental health. Because when you get an opportunity to share your story, to say your part, it gives you a sense of healing. You know, it makes you feel that you're victorious, and it helps you get to the next stage. Now, my story, this is how it started. I'm a civil engineer, yeah, and a construction manager. I'm also a project manager and also a contracts manager. So I wear a lot of hats. And for the past couple of years, I've been involved in a lot of infrastructural development, especially here in Lesotho. I've been in Lesotho since 2011, and I've been building roads all over this country. So it's been quite challenging for me. And I, in the process of doing my job, I basically just neglected myself. I was concentrating more on the job. My divorce also didn't really help because it made me quite vulnerable, and I just let myself go. So, and in order to deal with those issues, I was traveling a lot. I was in America, I was in the UK, I was in Europe. I was traveling, as a way. But in construction, for a lot of us who are in construction, you know that the only holiday you get is in December, which we call the end of. Usually, I use that period to do quite a bit of traveling. So 2023, I lost my mom in 2018, and I'd not been in Nigeria for quite a bit. So I said, you know what? This year I'm not going to go to Nigeria. Let me go visit my family, my elderly uncles and aunties, so that at least if they're even going to go, I would have seen them, So I got on a plane in December 2023, and I went home to arrive in Lagos. And you know how Lagos is now, how Nigeria is with parties and all this. I was attending parties, and prior to that period, I think around October when I came back from the UK, my body, I started to feel that something was wrong with me. I was having chest pains and say, maybe stress. When I go to Nigeria, I will rest and relax and everything will be fine. 27th of December, just a few days after Christmas, I traveled to Ilorin to visit my elderly aunt and uncle. And we had dinner, catching up and all. So I retired. And when it was 9:45, I felt this very sharp pain I've never felt before. Till 5 a.m. in the morning when they took me to the hospital. We had to go to like 3 hospitals before we arrived at in Ilorin. And the cardiologist came the following day and said, Mr. Williams, you're having we can't help you. You have to go to Lagos. So I got on a plane because they said I can't go by road. It was too complicated. And I got on a plane, arrived in Lagos, and I was at, believe me, kudos to the way Nigeria is developing now. I never believed that we have such a facility in Lagos. Those people are the best. The whole country. I was even offered by my medical aid that they wanted to fly me. They were going to send me an air ambulance to come and fetch me in Lagos and bring me to Johannesburg. I want it done in Lagos. So they prepped me, and I had to have a cabbage, as they call it, um, cardiovascular bypass surgery. And they had to open me up, and they said they couldn't stem 7, so they have to open me up. Long and short, I was hospitalized in Lagos for about 6 weeks. Because I knew, because I had a long prayer that, you know what, God, please, I've not finished doing what you sent me to come and let me achieve my destiny. Let me do what you sent me. Besides, my kids are too young. They can't afford to lose me. I'd said a lot of things. Specialization period was very surreal because I had a lot of time to think, reflect, and plan for my next move. When I was released, or I was discharged, I had a complete change in trajectory, life trajectory. You know, all the things that I used to bother me, you know, I had time to reflect and to be thankful. I promised myself that if I make it, you know, I had the support of my family, my friends, my colleagues. People cannot even be, Wale, you are a robot. You that you can do this and you can do that and you can, you know, you can drive 7 hours, you can drive 13 hours, you can. How did this happen to you? Huge wake-up call for me. And because of the support that I got from everybody, until now, it has allowed me to be a bit more thankful. You know that kind in the morning, and you just wake up and say, thank you, Lord, that I woke up this morning. When you have a health episode or mental health episode, it changes your trajectory, your life trajectory. Change my diet, change my social, change my work pattern. Those things, they humble you. Sometimes you pray that you do before you realize how important your health is. But, you know, sometimes you need to have such an episode for you to realize how important you are going to overcome those challenges. You start to devise means. Listening to Muiwa the other day, it was very serene because I was so scared to go back to the gym. I mean, I used to play squash for an hour. And I've done my runnings, and then I go and play squash, and then I walk into the sauna and I sweat a bit. I had that routine, and I was doing it 3-4 times a week sometimes. Go back into the gym. But you know, sometimes when you hear people like Muiwa talk, and then they assure you, you know, those things they tell you, it helps to shape your health healing process. And I learned my lesson. You know, sometimes the things that stresses us, it's not so things that we put in our heads that we worry about. It's not as important as we make it to be. Sometimes you just say, let God handle it. And it does. God just handles. I learned a lot of lessons from my mental health challenge. And I'm still learning, even till now. Moving forward. And that your next steps, your next endeavor after you have overcome a health challenge becomes very clear. You become very focused, very determined, But that's my story. That's my story. The next slide of towards overcoming your health challenges. You need to take action. These are some of the things I had to do. I didn't do all of it, but these are some of the things that I had to do, because if you changes and you let it simmer, it might just kill you. After suffering a life, changing health episode, it becomes a bit difficult to get back on your feet. True, because sometimes you're scared, sometimes you're complacent, sometimes even you are too, there's a lot of anxiety. So you're taking the first step can be quite daunting, and it's true. But trust me, every small action you take can lead to significant improvements in your well-being and quality of life going forward. One, acknowledging the importance of your health and making a commitment to prioritize it. Yes, because like I tell you, when you're in that situation, believe me and give me back my health. You get to that stage in your prayers. The second thing is seek out resources and support systems that can guide and motivate you. And that is those resources we're talking about: family support, gathering people together, people of like minds who can help you. Adopt healthier eating habits. Whatever happens to us is a function of what we put in our mouth. It's so true. However we look, however we develop, whatever we think is a function of what we put in our mouths. So you need to. For this one, I'm still struggling, but I'm trying. I eat a lot of fruits now. I'm not a very good fan of vegetables. You won't catch me eating a salad. But some very nice salt, a lot of greens, spinach. I love spinach. Of course, regular exercises incorporate regular exercise into your routine. I'm busy in Berea now. It's 6.3 kilometers road that we're building. Every other day, at least I walk about 1.5 or 2 kilometers before I ask the bucket to come and fetch me. Mental health issues, of course. Talk to your psychologist, talk to your pastor, talk to your friend. Sometimes these professionals, they help you. Progress, no matter how small, and recognize that each step forward is a victory. That is so important. Pat yourself on the it's important. Remember, you're not alone in this journey. So taking action today can lead to a healthier and more fulfilling future. Embrace the journey with hope and determination, knowing that you have the strength to overcome any health challenge that comes your way. Now let's conclude. Overcoming health challenges is a journey that demands resilience, determination, and comprehensive approach. It involves addressing the physical, mental, and emotional dimensions of health to achieve overall well-being. By adopting the following, we can navigate the complexities of health challenges and emerge stronger. Number one, just like we said earlier, incorporate, excuse me, your healthy lifestyle. Incorporate balanced nutrition, regular exercise, and adequate rest to support physical well-being and prevent chronic diseases. Preventive healthcare, regular checkups, screening, and vaccinations. These are essentials for healthy detection and prevention of health issues, reducing the burden of chronic conditions. Mental health support, assessing therapy, practicing mindfulness, and managing stress. These are crucial for maintaining a mental and emotional balance. Social support systems, building a network of family, friends, healthcare professionals, and support groups that provide encouragement and resources and shared experience. Personalized healthcare plans, tailoring treatment plans to individual needs ensures a holistic approach to managing health challenges and improving outcomes. Healthy coping mechanism. Engage in activities such as journaling, creative expression, and relaxation techniques to process emotion and alleviate stress. So in conclusion, anyway, our exploration of overcoming health challenges, excuse me, it becomes evident that this journey, though often arduous, is a testament to the human spirit's resilience and tenacity. Every step taken towards better health, no matter how small, is a victory that paves the way for a brighter, healthier future. The key lies in adopting a holistic approach that encompasses physical, mental, and emotional well-being, and by making informed choices, seeking preventive care, and leveraging support system, we can navigate the complexities of health challenges with greater confidence and determination. Ultimately, overcoming health challenges is not just about surviving, but thriving. And that is true, because your next stage is, after surviving it, you want to, continue living your life properly this time, because you feel that, okay, you know what, the last few years, you had not lived it properly. It is about reclaiming control over our lives, finding strength in adversity, and inspiring others with our stories of perseverance. For those of us who have encountered a life-changing health challenge, we need to embrace the remaining part of our journey in our lives with hope and optimism, knowing that each step forward brings us closer to the healthier and more fulfilling life. We should always remember that we are not alone, and countless individuals have faced similar battles and emerged victorious. We should let their stories be a beacon of hope and motivation, guiding us towards our own path of resilience and recovery. Finally, we need to take action and embark on the journey of overcoming our various health challenges with unwavering spirit and determination. Thank you. Thank you, everybody, for listening.
Thank you very much, Wale. It's been a fantastic and holistic session. Let's open it up for questions.
Yes, please.
Sorry, I'll ask a question. Sorry, I was trying to find my hand to raise up my hand and speak. So Wale, thank you so much for sharing that with us. I'm happy I'm one of the people that you kind of reached out to at the beginning when you were going through this as well. And I think what I just want to add is not what has pretty much said everything we need to reaching out to people, seeking help, and all of that. So what I want to just add to what I said is that is for those of us on the other side, where what I'm trying to say is that we should also be in a position to be a listening ear, to offer ourselves out as pillars of support. We cannot be going through, but let us be receptive to listening to people, and also make time for them, not just say, look, I'm busy, I'm doing this, because I also feel that when we do that as well, we're also helping ourselves. There's so much we can learn from. It's not so much what we're offering to give comfort, but it's also what we can learn from going through um situations that Wale has gone through. So I think that's what I wanted to say. Just on the other side of the fence, they're lucky enough to not have gone through such things. I went through a period of pericarditis 20 in the year 2000. I thought I was going to die. I was having a heart attack. Felt like a heart attack, more not what uh, as much as what Wadley went through. But I had family then. I didn't have much friends because I had just come into the UK, and like I didn't know anybody. And young black man, they feel that drugs is just leaving me alone. But obviously, the medical staff in war was going through. So when you do have a person or somebody who can, they might not be able to relate to what you're going for. They're able to just empathize with you, sympathize, and it helps. So not just the person going through, but also helps us ourselves understand better. You just knowing what somebody is going through and help prepare you for someone else to be able to, you might not be able to be there in person, but you'll be able to give advice. Oh, I knew somebody who went through this, what they did, what I heard that they don't know, I couldn't offer much, but this is what I know, maybe it will help. So that's what I wanted to just throw in.
Thank you very much, Wale. Nice one.
Thank you.
Any other questions?
Thanks, Wale.
Right, fantastic. So we'll round it up. I picked up a lot of things. I noted a number of sayings. One that I really believe in is knowing is wisdom. I mean, you can't run away from knowing, right? So figure out what
So
might
true.
be there and try to manage it. Also throw in something which I suffered from was finding myself waking up very early and not getting much sleep. I responded by going to bed earlier for a very long time, which I still have that habit of going to bed at 8 o'clock. But later on, I did what is called a sleep study and found that something called sleep apnea is not that big a deal. You find a lot of people. In fact, I now found out that a number of my friends had the same thing, and it was something that was causing me not to sleep properly. So if you start finding that you're waking up too early, or you're not sleeping well, or you're not rested when you've slept, then consider doing a sleep study. So we have no other questions. I will thank Wale for the time he took, not only to prepare this, but also to share it with us and to be vulnerable with us. We really appreciate it. And you can see that most of the people stayed till the end. Thank you very much for a fantastic job. And we look at more contributions and presentations from our classmates.
Thank you guys for giving me this opportunity.
Thank you, Adi. Thanks a lot.
Thank you, Wale.
To do this.
Really insightful.
Thank you very much, guys.
All right. Have a great week ahead, folks.
All right, then.
You
Take care,
too.
everyone. Bye for
Bye.
now. All right.
Bye.